It's a lovely edition, yet another beautiful edition of Nonye's Healthy Living Show, where we get to talk about different strategies where you can stay healthy and live a happier life. Remember, they always say that a healthy man is a wealthy man, but here we say that a healthy man is not only a wealthy man, but a healthy man is also a happy man as well. Welcome to yet another exciting edition of Nonye's Healthy Living Show, where your health matters. Today on the program, we'll discuss a very important topic that most people might not actually think it matters, or some activities that people do, but they do not even know that it has a long term effect, or we can say it's over time, it takes a toll on their health. What are we talking about? We're talking about sedentary lifestyle. Have you ever wondered if there are any side effects to sitting at a place for a very long time without engaging in any physical activity or the other? Have you ever wondered if there is anything wrong with bending for a very long time without any form of movement? Well, we'll get to find out today on the program. My name is Priska Wangwo. Welcome to Nunez Healthy Living Show. And just like I said earlier, today our spotlight will be on the dangers of sedentary lifestyle and, of course, how to combat it as well. Do you know what you need to do to combat sedentary lifestyle? All right, joining the conversation today on the program, we have Dr. Pharmacist Olebube Okoye Alphonsus. He is a resident doctor at Chukwuemeka Odumegwu Juku University Teaching Hospital, Oka. Doc, welcome to the program.
Yeah, it's my pleasure. Thank
It's a pleasure to have you.
Yeah.
You know, I just said that people ever wondered if there are any side effects to sitting at a particular sport without movement, without stretching for a very long time, or standing or bending or just staying in one place, especially office workers. People that are always at their desk, they do not go anywhere, they do not make any movement. But I guess since you're here today, you're going to tell us more about that.
Sure.
Okay, we'd like to begin the conversation with understanding what exactly is sedentary lifestyle for the layman that is hearing it, and the person will say, ha, you have come again, which one is sedentary lifestyle again, and all that. So basically, break it down for us.
All right. Talking about sedentary lifestyle, it's all about sitting or lying down in a particular place for a long period of time. And sometimes maybe as an office worker, someone that is pressing the phone, watching television, the person sitting down in a particular place for a long time is said to be sedentary. And the issue with sedentary lifestyle is that, according to the WHO, it has been discovered that more than 40% of the world population is at risk of sedentary lifestyle.
Wow.
Meaning that 4 out of every 10 persons live sedentary lifestyle, and that's about 3.2 billion persons. And the issue with sedentary lifestyle is that recently, because of the issue with COVID-19, sit at home, work from home, the incidence of sedentary lifestyle have increased dramatically. A lot of persons, a lot of things are now being done at home. People now work from home, people sit at home. And because of that, a lot of persons tend to live sedentary lifestyle, and it has increased a lot of health hazards to a lot of individuals. Yeah.
Okay, what do you think? Is it a question of choice, or that people do not know any better?
Well, I think it's both.
Okay.
First of all, some persons naturally love sedentary lifestyle.
They prefer to just get stuck at one place.
Yeah, stay indoors. They don't like activities. Okay. There are some persons that they will tell you that I'm an indoor person. I don't like going out and the rest. Then sometimes it may also be as a result of they couldn't help it. Just like the instance I gave during the period of COVID-19, when people were forced to sit at home, to work from home. And even if you are an adult person, during that period of time, you just have to be, you are forced to stay at home during that period. So it's both a choice and what people could not help.
Okay, now, is there a way sedentary lifestyle affects cardiovascular health or metabolic functions? Like you see some persons, they might just lie down and they won't stand, or they will just stand, get food, come back, lie down there. eat the food, drop the plate, and continue lying down at the same position. In terms of cardiovascular functions and metabolism, because like I said, some persons might eat still at that same spot. Is there any effect this lifestyle has on their
Sure, it's
cardiovascular function?
yeah, sure. It has a lot of function. Uh, the issue there with sedentary lifestyle, especially with regards to the cardiovascular health, is the fact that it can cause thickening of the blood vessels. We call it plaques. It will accumulate. Just look at it as a station whereby a pipe that's supposed to be flowing is made to be stationary. You discover that a lot of things can settle down, a lot of things can accumulate, and because of that, it can lead to thickening of the blood vessels, and we call it atherosclerosis in medicine. And as a result of that, it can lead to hypertension, it can lead to stroke, it can lead to lots of cardiovascular disorders. And talking about metabolic function, yes, it also affects digestion. We've seen instances of several persons that have cases of indigestion, and we call it reflux. They eat and they feel that their food doesn't digest very well as a result of not being or living a sedentary lifestyle. After eating, they stay in one place. There are some persons that immediately after eating, they lie down, and it will affect digestion. Instead of the food moving down the digestive tract, it kind of reflux or goes back, and the person will start having heartburn, indigestion, and several things. So it has a lot of effects on both the cardiovascular function and metabolism.
Okay, all right. Still talking about the sedentary lifestyle, like, are there other health implications beyond the cardiovascular function and metabolism of humans? Are there any other health implications of this sedentary lifestyle?
Yes, there are quite a whole lot of other health hazards to sedentary lifestyle. It's been shown that sedentary lifestyle increases the chances of coming down with certain cancer of the colon, cancer of the stomach, even uterine cancer. Because one thing about sedentary lifestyle is that it affects all the systems and the organs of the body. And when organs are not functioning properly, it gives room for cancerous cells to grow. So sedentary lifestyle increases the risk of certain cancer. Then the issue with diabetes. It's been shown that living a sedentary lifestyle increases the incidence of one coming down with diabetes. And the issue there is that, when you talk about diabetes, it's as a result of insulin resistance, all right, or the pancreas not producing enough insulin. It means that as we are eating, the body is not taking up the glucose. And when the glucose becomes so much in your blood system, you are said to come down with diabetes. And it's been shown that one living a sedentary lifestyle can increase the chances of the person coming down with diabetes. So sedentary lifestyle can increase the chance of one coming down with diabetes. Then another issue with sedentary lifestyle is that it affects the function of the immune system.
Okay.
Yeah, there are some persons that they are always sick from one sickness to the other. They are treating one disease or the other. And we've discovered that if you look at them, most times they live sedentary life. They are always in one place after eating, sort of, walking around, exercising, and, trying to, get themselves active. They are usually in one place. And because of that, it reduces their immune system. And as a result of that, they can, come down with a lot of sicknesses, a lot of diseases. Another thing is obesity, which is very important. A lot of persons are on the big side, and most of the times, the reason why their weight keeps increasing is because they are not exercising. They are usually not active. They live sedentary life, and as a result of that, you discover that. And one thing about obesity is that it can lead to a lot of cascade of other disease conditions, hypertension, diabetes, a lot of metabolic issues. And that's because the person is living sedentary lifestyle. So sedentary lifestyle can also cause one coming down with obesity. Then mental health, which is very important. It's been shown that living sedentary life can lead to one coming down with mental health disorders like depression. When you stay in one place, you are not active, you are not walking around, it increases the chances of that person coming down with depression, because most times, because you are just not active, you have the time to think of a lot of problems that you are facing. But when you're out there, you are exercising, you are meeting people and the rest, you really don't have so much time to, start thinking and meditating over certain challenges that you have. And that's why sometimes we tell people that maybe you are passing through some personal, emotional challenges. We'll just advise you to just, rather stay indoor, why not just come out, walk around, and get to meet people? Yes, it's very important. So it can also affect or lead one coming down with depression, anxiety too. The another thing is cognitive function. That's the intelligence, one being articulative, being able to, the cognitive function. It's been discovered that living a sedentary lifestyle can affect cognitive function. Discover that your brain is not as sharp as it used to be. I mean, you've been very active, very sharp, and your cognitive function is very high, but suddenly you discover that it's kind of going down dramatically. It may be as a result of the person living sedentary lifestyle. And in addition to cognitive decline, it can also lead to dementia. Dementia is an irreversible cognitive function when one has lost ability to, reason very well, remember things, and even remember faces. Can get to the point that the person, you see somebody that you don't remember the person. And most times, usually more commoner in people that are elderly, in their 70s, 80s, and the rest. But it's been shown that the incidence of dementia are increasing over the years. Now we see people that are in their 50s, are in their 60s, coming down with dementia. And if you look at it very well, you discover that because a whole lot of persons are now living sedentary lifestyle. That's the truth. So it's been shown that cognitive decline can be as a result of one living a sedentary lifestyle. Another thing is musculoskeletal function. That's the function of your muscles and your bones.
Okay, if you're not moving, if you're just stuck at a place.
Exactly. And a lot of persons complain of back pain, neck pain, joint pain. And if you look at it very well, you discover that it's because they live sedentary lifestyle. They're just in one place, they're not walking around, they're not engaging in physical activities. I think these are some of the things that...
Okay, Doc, they say like most people that are usually prone to this sedentary lifestyle we're talking about are people, most times office workers, people that their jobs do not require movement, that requires them to be at a place. Exactly. But what I want to ask is, okay, this category of people, like the workers that will have to be at a place, based on the job they do, is it still possible for them to have this kind of work? And if they exercise, are they still prone to some of the problems that can still arise from this sedentary lifestyle?
No. And that's where the issue of how do we prevent it comes in. Yes.
Like I'm a worker Monday to Saturday, I'm stuck in my office with my desk, but probably on Sundays maybe I go to the gym. Is it possible for
yes,
me?
It can augment. And even before that Sunday, how do you come to work? Some persons, if your workplace is very close to where you live, you can take a walk to your place of work.
What if I'm not taking a walk?
Okay, you can still, then a little time that you have, some persons, you're not stuck in your workplace every day, throughout the day. There are some times that you may need to go and get something, walk around the streets, or just very short distance that you need to cover. Instead of, trying to enter a car, you can decide to take a walk. So, but if the work doesn't permit you to maybe exercise or do certain things during the day, you can augment with other days that you have. Maybe on Sunday, on Saturday, you can take that period to go to the gym and exercise. Yeah.
Okay, all right, let's move out a little bit from medicine. All right, so now, technology. The smartphones, the streaming platforms, where you go to watch films, you go to listen to music, watch music videos. Now, do you think that all these streaming platforms and smartphones, they are contributing to sedentary lifestyle? And if they are, how?
Yeah, they do a lot. We are all victims of, social media, our phones, the tele, and most times we are stuck at one place, maybe watching a movie, you're online trying to do one thing or the other. And most times when you are doing those things, you are in one place. Most times you don't walk around doing those things. And discover that most people that live sedentary lifestyle is not as a result of maybe their place of work. The majority are as a result of maybe they're at home, maybe watching the tele, trying to stream one thing or the other. And I would say that it contributes a lot. And that's why most times we advocate balance. All right, these things are very good, but it's very important to balance them out. Don't just always be at home. You are, always on your phone, always on technology, sitting in one place. It's very important to balance it out. So I think it really contributes a lot. So,
Okay, if we are looking for an alternative, I have a job, like I said,
okay.
that requires me, for instance, customer care representatives, that you have to stay close to your phone, picking calls, attending to customers, and you know that you can't move from there until probably somebody else comes to relieve you. Now, in this kind of scenario, are there medical advice or medical strategies that one can adopt? Somebody that has a job that requires that the person has to be inactive for a period of time. So are there things the person can do while still on the job?
Yes, the person can do a lot. All right. Number one is that you can take a short break. Maybe as you are walking, can decide to just stand up a little within a minute, 30 seconds, take a stretch your body, sit down, continue your walk. Then, and most jobs, most times, you get to have like 30 minutes or 1 hour break.
What if you don't?
Anyway, if you don't, you can still make do with the little time. Once in a while, try to stretch, try to stand up, stretch your body, and just make sure that you're not just in one place. Yes. Then after your walk, and most jobs are just from 8 to 4. All right. And the issue is, what do you do after work? Do you just still from there enter your car, drive home? When you now get home, you're also on your smartphone. From there you sleep. The next day you start again, and the cycle continues. That's the issue. Most persons, it's not because their job makes it that they live sedentary lifestyle. It's what they do after their job. If they have a way to balance it after work, you try as much as possible to exercise. Just make sure you are active, knowing fully well that you've been in one place for a long period of time. It's going to help a lot. Yeah.
Okay. All right. So now, basically, are there physical conditions that can manifest as a result of somebody being stuck beyond diabetes, hypertension, obesity, and weight and all that? Are there physical conditions that can manifest as a result of inactivity beyond those serious medical issues?
Yes. Well, most times, most of the persons, they will tell you that they discover that their body is somehow becoming stiff. All right. Some, elderly people or even young persons, they may start complaining of joint pain, back pain. Oh, I've been in one place for a long period of time and discovered that my neck is aching, my waist is aching me, and as a result of that, it may be because they live sedentary lifestyle. And most times from practice, we discover that the incidence of arthritis in elderly people are more in people that are always in one place.
Really?
Yes. You get to see elderly people complain of knee pain, their knee is
Yes.
paining them, and it's very painful. And if you look very well, most times they are on the big side and they are always in one place. And usually you discover that it may be when maybe they retire from work, active service, when they are still actively working, they usually don't complain of that. But when they stopped working, they discover that the issue with knee pain, joint pain has increased. So I think these are some of the physical manifestations aside the chronic and serious things like hypertension, diabetes, and the rest.
Okay, now a short burst of activities, like you said earlier, that you could be sitting at a place, you decide to stand, stretch, do one or two things. Is it enough to avoid any long-term effects that can arise as a result of this sedentary lifestyle?
Well, I don't think it's enough. Yes. And that's why I said, what do you do after work? And I don't think there is any job that will make you work from Monday to Sunday.
Our job do.
All right, but at least you still have some days or some hours that you're out of job. I mean, out of work.
Yes.
I mean, maybe you work from 8 to 4 p.m. And after that, or let's say 6 p.m., after that, you still have some time to do one or two things, all right? The most important thing is, what do you do outside your work? And one thing about this thing is when you prioritize it, I need to be active. My job doesn't permit me to, live active life. So what's after work, I will try as much as possible to make out time, even indoors. I mean, before you sleep, you can decide to do that exercise in your room. You can also get some of the little gym equipment in your room and exercise there. You can skip, You can do one thing or the other. I mean, outside the work, when you are no longer working, that is really very important to make sure that you prioritize it. Oh, this is something that I must do. It's very important for me to exercise. It's very important for me to live an active life, and hence make out time for some of those things.
Okay, so do you think that there is enough awareness about sedentary lifestyle and health implications that could arise from it based on your years of practice as a medical doctor? Do you think it's something that people are actually aware of?
No, I don't think. A lot of persons are now aware of that. And that's why, as I said before, the incidence of the dangers of sedentary lifestyle are on the increase. These days, we get to see younger persons suffer from hypertension, even diabetes, obesity are on the increase, and a lot of health conditions are on the increase. And that's as a result of the fact that people are not aware. All right. And when I started, I talked about that this sedentary lifestyle is as a result of the shortfalls of the sit at home that happened during COVID-19. And a lot
So
of
are you saying it's not something that was already in existence?
it
Is
was
it?
there, but the incidence increased
Oh, okay,
afterwards.
okay.
Yes,
COVID increased.
exactly. Because people get to now sit at home, work from home. Even these days, there are some persons that
Most jobs that require you to work from the
exactly,
house.
virtual, you connect from your house, and even interviews now. So rather than going in person, you can do some virtual interviews. Whereas before now, it will require you to probably travel to that place and do your interview. But these days, people get to do those things from home. And all these things are contributing to sedentary lifestyle. So I think people are not aware. They are not informed, because if they are, we won't be seeing the increased incidence of some of the dangers of sedentary lifestyle.
Okay, so do you think there are lifetime or lifestyle changes that people can actually adopt to combat the pitfalls of sedentary lifestyle?
Sure, there are quite a lot of lifestyle changes. And the first and the most important is exercise. All right, it's important to exercise. And most times when we talk about exercise, people tend to think of going to the gym. It's important. That's a part of exercise.
Okay,
Right? But there are other things that one can do, and it's a form of exercise.
okay, like
Taking a walk. All right.
is that more effective than lifting weights? Using one of the dumbbells and all that?
Well, if you cannot, if you don't have those things available, I mean, you don't have access to the gym around you or anything, you can still take a walk. And, rather than maybe you're going to the market is not far, rather than, entering your car, driving to that place, you can decide to walk. Some people do evening walk. They've been at home all the day, and in the evening, they just leave the house, they just take a walk from down the streets, and walk back. It's part of one trying to exercise. Then another thing that is very important, as I said before, going to the gym, which is good. Engaging in active exercise, we call it aerobic exercise. As you're exercising, the good thing there is that it helps blood to flow. It makes your body active. It makes you more articulate. It's discovered that when you go to the gym, when you exercise, there's this sense of good feeling. You feel good. That's why most times, even people that are depressed, we encourage them to go exercise. Because after they finish exercising, they discover that they feel better. They no longer have this low mood or depression. So, in addition to going to the gym, you can take a walk. You can decide to do an in-house exercise. You can get a skipping rope, and before you sleep, maybe just take like 50 or 100 skips before you sleep. It's an exercise. It's a form of exercise. Rather than, most times, because when I discuss with people and tell them about sedentary lifestyle, I discover that most times they're waiting for an opportunity to go register in the gym, and maybe have days they are going to the gym. And because of the schedule of some persons, their work, it won't permit them to always be there. I know some persons that they register some of them told me that they registered and they only went only once or twice. That's how the month elapsed, and they had to pay again. And after some time, they get discouraged, and they don't no longer subscribe. But what they do in-house is very important. Try to outside, active exercise, take a walk indoors, try to do one thing or the other exercise. Can even do little press up, can also buy some of those equipments at home and use it for exercise.
Okay, so do you think the workplaces actually can help with regards to combating the sedentary lifestyle?
Sure, it can. In advanced climes, workplaces are equipped with some gym equipments. That's true. And the reason is because so that, like some work, like you talked about, that requires you to always be in one place. During your time of break, you can always go down to the gym and do one or two exercise. Or maybe some persons that get to maybe, let's say, sleep in their place of work, do 24 hours job, they're on call, and they can always maybe early in the morning go down to the gym, exercise, and all right, try to before they continue their work. Then another thing the workplace can do is to always make sure that their workers have period of break, rather than having them sit in one place for a long period of time. I mean, somebody being in one place from 8 a.m. to 4 p.m. They are sitting down, attending to customers, talking, doing this, doing that. Once in a while, let them have like 1 hour break, 30 minutes break. And I know that there are some workplaces that 12 to 1 p.m. is period of break.
Yeah.
You can use that time, take your lunch, exercise, do one thing or the other, then come back to work. And within that period, you can use it to probably leave your place of work, take a little walk down, come back, and it's. So I feel the place of work really has a very huge role to play.
Okay, all right. It just remind you that this is still Nunez Healthy Living Show right here on Anambra First. We will take a short break and when we'll come back, we're going to be getting reactions from people via our social media handles. So you can join the conversation online on Facebook, Anambra First, and we'll get to read out your comments. And if you have questions for the doctor in the house, he will also get to answer some of your questions because based on what he has said and what I know so far, it looks like a lot of people do not even understand what sedentary lifestyle is all about. And that is the reason this show is here to educate our people with regards to some practices that are involved in that they do not know could actually be harmful to their health. So we are here to provide solutions to all your health needs. It's Nanya's Healthy Living Show, and we'll be right back. It's still Nanya's Healthy Living Show right here on Annabelle First, and our spotlight is still on a sedentary lifestyle, dangers, and how to combat it. And we are still speaking with Dr. Pharmacist Olaibubi Alphonsus. So he has been telling us different things with regards to how people can practice more active living. You avoid being stuck at a place because it has some health implications, and if you need to stay healthy, you need to understand what constitutes a sedentary lifestyle and how you can combat it. All right, from our Facebook page, we have Ugunabo Anambra saying that this is a wonderful topic. And the B Kalita says, I always try to avoid a sedentary lifestyle. That is why I'm always on the move. Adamira Francis said, interesting topic of discussion. Rita Marian also echoes interesting topic of discussion. All right, so there's a question for you here, Doc, from Jeff Wachuku. He says, is it possible to lead a sedentary lifestyle while young and then transition to a healthier lifestyle later in life without facing negative consequences?
Well, it's possible, but it depends on how much of sedentary lifestyle the person have lived. All right,
Okay,
because
what constitutes how much?
well, it depends on, there are some persons that all through their life, they're always in one place. Let's say from childhood, they're always on their phone, playing video games.
Okay.
And because of that, it's discovered that one thing about sedentary lifestyle is that it affects the organ and the tissue,
Oh,
right? So it depends on how much damage has been done. It's possible that while younger, the person lived sedentary lifestyle, but it didn't do so much damage to the body system, and the person still, maybe when the person might have grown older, now start living active life. I mean, the person may not see the effects of sedentary lifestyle, but if the person lived most of his life sedentary way, discover that the person may end up seeing the implication of the consequences of sedentary lifestyle. So I think generally we advise people to make sure that you don't live sedentary lifestyle. And if you once lived, stop living. Make sure you are active. And if the person that asks the question discovers that he's okay, he's active, I mean, he's not suffering from any of the consequences of sedentary lifestyle, it means that probably it has not yet done so much harm to the system for it to manifest.
okay, because he's saying that even if he was, maybe living a sedentary lifestyle while he was young, and when he now gets older, he starts, transitioning to more healthier life. But there is an Igbo saying that says that you can't get healthy. So does that apply in this one?
Well, the point there is that most times we advise people to make sure you live an active life. All right. There's a Chinese proverb that said that the best time to plant a tree was 20 years ago. The second best time is now.
Okay.
All right. Yeah, the best time not to live a sedentary lifestyle was yesterday. The second best time is today.
Okay.
If you are living sedentary lifestyle, or rather, if you lived sedentary lifestyle, it's important that you stop living. And at the end of the day, we hope that the times that you live sedentary lifestyle have not yet done so much harm to the system.
Okay, so do you think so far there are now innovative approaches or technologies that have been developed to address this sedentary lifestyle? Because I know once I saw somebody saying I was with somebody and all of a sudden she stood up, please, it's time to drink water. Apparently there was an app in her phone that
Exactly,
was
yeah.
tracking her water
Water
intake and all
intake
that.
and the rest.
So far, are there other innovative approaches like this one that tracks your water intake when you have to ease yourself? Okay, it's time to go relieve yourself. All those.
Yeah, I
Are
have
there
one of
ones
such in my
that
phone
address this
that
sedentary
that
lifestyle?
tracks the number of steps I take per day.
Oh,
Yeah, most we advise people that you try as much as possible to take at least 10,000 steps a day.
is it?
Yeah, 10,000 steps.
Is that
All right,
something that's possible?
and it's possible.
Ah.
Right, and at the end of the day, my phone shows me the number of steps I took. Yeah, in a day. It's an application that you can download, and you can key in what you want. All right, number of steps, number of water. Can even time it, the period or the duration. Okay, I need to be taking water every 4 hours. Just like that person, once it's 4 hours, your phone will bring up notification. You can take water. And so when it comes to exercise, even your phone can track the number of hours you took to exercise, number of steps you took per day, and other things. So I think that's also another way to make use of technology that is now making people to live sedentary lifestyle, to curb sedentary lifestyle. It's a two-way thing. Yeah, technology has contributed to people living sedentary lifestyle, but it can
And
also help people to
another way, it's also contributing to.
people dealing with sedentary lifestyle. But the issue is that most people don't know about it. Yes.
So you guys in the field, because the ripple effect of this sedentary lifestyle is that you're going to be plagued by one health hazard or the other.
Yes.
So at the end of the day, we end up coming to the doctors to treat us from this ailment. So what other innovative approaches based on your practice, people in the field, medicine, that you guys are bringing to, address?
Yeah, another thing is what we are doing now, public enlightenment, advocating for it, letting people to be aware of the hazards and the side effects of sedentary lifestyle. People need to be aware. They need to know that living sedentary lifestyle is not very good for their system, that is going to lead to quite a lot of health challenges and hazards. Then I think that's basically the most important thing. Information. They say knowledge is power. People need to be aware that it's important that they live active lifestyle. It's important they try as much as possible to not to live sedentary lifestyle. And another thing is diet. All right.
Okay,
We
all
didn't talk
right.
about it.
Yeah, we
It's
haven't.
very important. Most times, the amount of food you eat should be commensurate with how active you are for the day.
Wow.
Yes. It's not a must that you have to eat, let's say, 3 times or number of times a day. If you discover that you are not active during the day and you just been at home, you don't really need to eat so much compared to someone that maybe has
always
been
on the
very
move, that's been
active
going
and
out.
yes, has been on the move and the rest.
Oh.
So, and that's why we advise people, if you discover that, okay, a place of work doesn't permit you to live an active lifestyle and the rest, you can as much as possible also curb your diet, watch your diet. Make sure that you don't eat so much, because the issue with eating too much is that the excess, what the body does is that it will go down and accumulate.
Okay, it stores the excess it doesn't need.
Yes, exactly.
Wow.
And most times we advise people that when it comes to diet, in the morning eat like a prince, in the afternoon eat like a king, then at night you eat like a pauper. That's the adage.
Okay,
In the morning,
eat
eat
like a
like
king,
a prince.
a prince in the morning.
Yes.
Okay.
In the afternoon, eat like a king.
Wow.
At night, you eat like a pauper, somebody that doesn't have money.
Oh,
Yes.
interesting.
But unfortunately, in our environments, it's at night that people get to eat those heavy food.
So it's at night that people eat like princes.
And the rest,
Oh,
which is not very encouraging, because the issue is that after eating, the next thing you do is you go to sleep. And rather than the blood going to the brain to help you recuperate and be active for the next day's activities, going there to your stomach to digest the food that you ate. And after that digestion, what happens is that all those fats, they go to your blood vessels and go and accumulate there. And at the end of the day, the person will come down with hypertension, diabetes, obesity. I was discussing with a friend the other day, and he was complaining of, like, he's on the big side, he wants to reduce weight. And when I was discussing with him, he told me that he has not actually eaten till, that was around 4 p.m. And I now asked him, okay, when do you usually eat? It was like that most times he makes sure he eats at night. And after eating, maybe after like 1 or 2 hours, he goes to bed. Mm-hmm. And I told him that actually, you are eating where you're not supposed to eat. That is very important. Most times as doctors, we advocate, it's very important to take breakfast. It's actually the most important meal for the day. All right? Then because it prepares your body, it gives your body enough adequate energy, glucose that you need to function for the day. But at night, you don't need to eat much, because it's not like your body literally doesn't need much of that food. You don't need to, you're not working, you're not exercising. After eating, the next thing you go to bed. So that's why that night's meal should be reduced, because you're not active. In the same vein, if you're not active during the day, you can also curb your calorie intake to avoid the side effects of sedentary lifestyle. Yeah.
Okay, interesting. So diet actually has a very huge role to play.
Yeah.
Okay, what about the type of diets? You've spoken about the timing for eating. What about the things, the type of diet to eat? Is there a way dieting, like the food you eat, could also help
Yeah,
if you're living a sedentary lifestyle?
yes, exactly. Very important. The type of diet is very, very important.
Because if you're saying eat like a prince, now if you eat eba in the morning, eat it in the afternoon, then in the night they might eat rice.
All right.
Or eat yam.
Most times we advocate that you can take food that is high in calorie when you are active. Let's say in the afternoon, because you know that after eating, you still exercise, you still walk,
Do other things.
you do 1 or 2 things that will burn those excess calorie.
Okay.
Then at night, you can just take fruits. The eating like a pauper we talked about is actually at night. You can just take fruits.
Something light.
Yeah, something light and sleep. And at the end of the day, it doesn't constitute high calorie burden to your body system. And it helps, even the fruit contains vitamins, minerals that your body system needs. So most times the type of diet is very important. And that's why the type of diet is dependent on what you do.
Okay.
For people that are involved in high activity, they're always active, let's say laborers that are engaged in one very high active activity or the other. They may not eat like someone that is always on his laptop on the system. Most times you see them, they take a bar, fufu, it's very
Because they
heavy.
will still
Exactly, they will still
let it
burn
go.
it. Yeah. But so it depends on the kind of work you do. You try to narrow or mirror your diets to the activity that you do.
Okay. All right, it's still Nonye's Healthy Living Show right here on Annenberg Fest. We're talking about the dangers of sedentary lifestyle and how to combat it. We've been speaking with Dr. Pharmacist Oli Bube. Okay, all right, we still have other comments from our Facebook page. Ifema Clifford, Ume Oluchukwu, and Mego Anthony all echo that this is a very interesting topic that we need to talk about, and it's also very educative as well. And Ifoma Chukwukapi says that the dangers of sedentary lifestyle are serious, including increased risks of obesity, heart disease, and diabetes. It's also important to raise awareness about incorporating more physical activity into our daily routines, like working, exercising, or even engaging in fun activities. Okay, fun activities has got me. She said fun activities. So, what kind of fun activities can actually prevent sedentary lifestyle?
Well, there are a lot of fun activities, and most fun activities, it's something that makes you happy.
Because you know that exercising is something that people, in as much as here in Anambra State now, the governor's wife is changing the narrative.
Yes.
In all the 21 local government area, there's been an advocacy for every local government area to, start exercising, make exercising a part of their daily routine every Saturday. Presently, the governor's wife does it every Saturday here in the state capital, and now it's gone across the local government. So I would say here in Anambra that people's mindsets are gradually shifting, because every time you say exercise, people think it's one stressful
Big
thing like
yes.
that. So how can we also make this fun while encouraging people to avoid some of these health implications of sedentary lifestyle?
Yeah, another thing that one can do is dancing. If you love dancing, put up the music, start dancing, you sweat it out. Yeah, it's fun to dance.
Even if you don't know how to dance.
I mean, you can just move your body, try to do one thing or the
All
other.
of them are dancing.
Yeah, at the end, the most important thing is that maybe just there's a music that you like, and you just put it in the background. You dance. At the end of the day, the most important thing is that you are sweating, and it's it's a fun activity that will also help to curb sedentary lifestyle.
Okay. Yeah. All right. So medically, what would you advise people if you were to speak to people about the dangers of sedentary lifestyle? What would you say from your perspective?
Yeah, I would encourage people not to live sedentary lifestyle because we've seen an increased risk in a lot of chronic disease conditions, hypertension, diabetes, obesity, arthritis, depression, as a result of people leading or living a sedentary lifestyle. And it's very important for us to make sure that we are active. Just like you've said, you have to prioritize the importance of exercise. Make sure that you're engaged in active things throughout the day. Make out time to exercise. Make out time to do things that is outside sitting or lying down in one place. I feel that once people try to make it a priority, that every day there is something active that I must do. I must make sure I exercise. You can put it as part of maybe your phone reminder notification and application.
Just like the one that reminds you about drinking water.
About drinking water, yeah. Okay. So I think I need to encourage people to be active, live active life, don't live sedentary lifestyle. It's going to go a long way curbing some of these health hazards of sedentary lifestyle.
Okay, there's something that just came to mind when I was, researching about this program. So I saw a place one where somebody said that the fact that we are now more comfortable as a result of many innovations and technology, that technology has made us so comfortable, and urbanization has also made us very comfortable, that this comfortability has also contributed to sedentary lifestyle. Do you agree?
Sure, I do. And that's what we've been talking about here. That most times people no longer go to work, they stay at home to work. If you need to attend an interview, you do it virtually. If you want to, let's say, go to buy something, you may not even enter the market, you can call your vendor, the person buys it for you, bring it for you at home. Even these days, people can cook for you and bring it home. or maybe at work,
You don't
so
have to
going
move
outside
the
to go and
finger to
buy
do
food,
anything.
make a call, the person comes to your place
A
of work.
delivery person brings food
Yes.
for you.
It's covered that, technology and urbanization has so much increased, the risk of people coming down or living sedentary lifestyle. And that's why, as I said before, it has to be a priority. You have to make sure, you have to be intentional about it, knowing fully well that you are being active not because you want to stress yourself,
Okay.
but because you want to curb the effect of sedentary lifestyle. You don't want to be staying at home, always in one place, and at the end of the day, coming down with some of these things we talked about.
Okay, but honestly, do you see both as a professional and basically someone here, do you see sedentary lifestyle as something that can be curbed in the near future? Is this something that eventually will stop hearing? Do you see it?
Well,
Is there a possibility of that happening?
well, that would be difficult,
Why do
but
you
I
think
think
it's
we can
difficult?
still go a long way. Yeah, why I say it will be difficult is that with technological advancements, innovation,
Comes
it's
its own
going to get
peculiarities and
worse.
challenges.
That's the truth. It's going to get worse. But why I said we can go a long way is like what our governor's wife is doing, advocacy, active involvement, making sure that each local government, everybody, there is a time of the month, everybody
Sure,
come
yeah.
out to exercise. Place of work can also advocate that maybe once every month. There are some workplaces that all the workers will come out, they exercise once every month, maybe go to the field, run, play football, do one thing or the other. It's a way of trying to curb sedentary lifestyle. Probably because they've been working throughout the week, maybe one weekend they engage in some outdoor activities. Even sometimes there is this city marathon, city running competition. These are some of the initiatives that are put in place to help people deal with sedentary lifestyle. So I think it will be very difficult, but we can also go a long way. Advocacy, trying to enlighten people, let them know that it's not good for your health. You need to be active. You need not to live sedentary lifestyle.
But are the health implications more long term or short term?
I think it's more long term.
Really?
Yes.
Wow.
Yeah, because most times when you live sedentary lifestyle, you don't see the effect immediately. Hypertension, diabetes, and some of the things we talked about take years to come. It's not the day or the month or even the year that you start living sedentary lifestyle that you start seeing the effect of it. All right. It can take can even take decades, 10 years, 20 years. For something like cancer, cancerous cells can, once it starts, before it manifests, it can take 10 to 20 years. And so it's a long-term thing. It's something that doesn't happen immediately. And that's why we advocate this, because when people live sedentary lifestyle, they don't see the effect immediately. If it's something that you see the effect, for example, you are bitten by mosquito, you come down with malaria, you see the effect. You eat something that is infected, the food that is infected, start having diarrhea and vomiting. You see the effect immediately. You know that, oh, this is what's causing it. And if it's mosquito, let me flit the room, net my room, my doors and my windows, sleep under mosquito nets. You are curbing it because you are seeing the effect of it. But the challenge with sedentary lifestyle is that you don't see the effect immediately. And that's the challenge. At the end of the day, and when people come down with these things, they don't know. Oh, somebody is coming down with hypertension. The person doesn't know that. It's because I'm on the big side. It's because I've been living sedentary lifestyle. It's because I'm not exercising. They may think that, oh, it's because of one thing or the other, without knowing that these are some of the things that caused it. And that's why as doctors, as medical practitioners, things like hypertension, diabetes, the lifestyle modification we talk about is exercise. One of the most important lifestyle modifications is exercise. We encourage people to exercise. Make sure you exercise. And it's been shown that some pre-hypertension or even pre-diabetes, when someone changes his or her lifestyle, it can come back to normal, even without taking drugs. There are some levels that you have. It will not tell you to go and start taking drugs at that point. No, just change your lifestyle. Make sure you exercise. Make sure you eat well. Make sure you reduce your salt intake. Do this and do that. Change your lifestyle. And most times they come down healthier, better values, blood pressure, blood sugar, even something like arthritis. Somebody is having knee pain, joint pain, back pain. Most times we encourage them exercise. At the end of the day, they come back to you, they are happy. They feel okay. I used to have this patient that was on the very big side, and she was complaining of arthritis, this and that, and I encouraged her to lose weight. When she lost weight, at the end of the day, she discovered that these things are no longer there. she feels better. The whole arthritis, the whole joint pain, back pain, neck pain are gone because of, that she dropped her weight and she started living actively.
Okay, all right. Well, you heard from Doc here, and we've managed to establish that the dangers of sedentary lifestyle are undeniable, and it's affecting individuals both on a physical level, on a mental level, and of course, largely on a societal level. But the good thing is creating awareness, knowing about it, and knowing the dangers that comes with it will actually go a long way towards changing the narrative. And just like you said, there are a lot of health implications from obesity, diabetes, hypertension, cardiovascular diseases, and a whole lot. These are resultant effects of living a sedentary lifestyle. So that is why it's very important that we engage in one form of physical activity or the other. If you have a job that requires that you need to sit at a spot for a very long period of time, well, just like doctor has said here in the studio, try and do stretches, stand up, move around, and come back to your work position. But the goal is to minimize sedentary lifestyle because it actually has massive health implications. Well, I want to thank you, Dr. Pharmacist Okoye Olebebe Alphonsus. Thank you for sharing this knowledge about sedentary lifestyle with us today on the Yes Healthy Living Show.
Yeah, it's a pleasure.
Okay,
Yeah.
the pleasure is ours. Well, we've said our piece. He who has ear, let him hear. But remember, this show is not just for you to be healthy, but also for you to adopt lifestyle changes that could make you a better person. You just heard what the doctor said about his patients that was always complaining about arthritis, right? And
Yes.
when she lost weight, phew, everything disappeared. So most times the health conditions we face are something that we could actually change by ourselves
Exactly.
if we practice a healthy lifestyle. So take a decision, live a healthy life, because to live healthy is to live happy. All right, and this is where we draw the curtain on the Nye's Healthy Living Show. Just to remind you that the program makes a return next week, Friday. I am Priska Wanko. See you.